Have you noticed that your posture has changed over the years? Maybe when you look in the mirror, you notice your back is more rounded, your shoulders are forward, or you feel a constant stiffness and tiredness when you walk. Although many believe it is part of aging, the reality is different. It's not age that makes you hunched over. It's lack of movement that shuts down the muscles responsible for keeping you upright. After age 50, deep postural muscles lose strength, the spine stiffens, discs dehydrate, and even breathing becomes more short, affecting balance, mobility, and even your mood. But the best thing is that this process can be reversed with gentle exercises, conscious breathing, and consistency. It is possible to regain strength, flexibility, and freedom of movement without the need for a gym, machines, or prior experience. And that's why, in this video, I'll teach you step by step a 5-exercise routine designed especially for adults over 50 who want to relieve pain, improve their posture, boost circulation, and feel light, stable, and confident when they walk again. If you're ready to wake up your body and regain the posture you deserve, this will be the first step toward a stronger, more vibrant version of yourself. Exercise 1: Supine Twist. The supine twist is one of the most powerful restorative movements for the overall well-being of the spine and nervous system. This twist, practiced for centuries in disciplines such as therapeutic yoga, produces a profound biomechanical and neurological effect that goes far beyond the simple sensation of stretching. By gently rotating the spine in the transverse plane, a stimulus is generated that hydrates the intervertebral discs and improves their cushioning capacity, since the movement facilitates the diffusion of nutrients through them. This is essential, considering that the discs do not receive direct blood supply and depend on movement to regenerate. In addition, the twist releases myofascial adhesions accumulated by a sedentary lifestyle and stress, decreasing muscle stiffness in the quadratus lumborum for vertebral and oblique muscles. They are responsible for much of the chronic pain in people over 40 years of age. Studies have shown that sustained twisting and stretching reduces facial tissue density and modulates systemic inflammation, acting as a mechanical therapy for musculoskeletal longevity. Meanwhile, gentle mechanical stimulation of the spinal joint receptors activates neuromotor circuits that improve proprioception, balance, and coordination, essential markers of healthy aging and fall prevention. For this reason, physical therapists recommend this twist, especially for people with lower back pain, mid-back tension, sleeping hip syndrome, or problems resulting from spending too many hours sitting. But its impact is not limited to the musculoskeletal system. The gentle supine twist also has a powerful effect on the vagus, nerve digestion, and the physiological stress response. By performing this twist in a relaxed position, the body enters parasympathetic predominance, activating what is known as the rest mode, responsible for recovery, cellular repair, and cortisol reduction. Research by Dr. Stephen Porges, creator of the polyvagal theory, shows that movements that gently massage the abdomen, diaphragm, and core organs increase vagal tone, improving heart rate variability, HRV, a scientific marker of longevity and resilience to stress. In addition, the twist generates alternating compression and decompression in the abdomen, stimulating intestinal transit, releasing diaphragmatic tension, and helping to reduce symptoms such as abdominal bloating, constipation, or slow digestion. In this way, this practice creates a physiological reset, relaxes the mind, frees breathing, reduces chronic pain, improves posture. It refines the body-brain connection and rejuvenates the spine from the inside out. Due to its simplicity, impact, and safety, it is considered one of the most comprehensive exercises for maintaining a functional back, over the long term, making it a favorite among physical therapists, gerontologists, and life coaches. Exercise 2 Cat-Cow. The cat-cow movement, originating from practices such as therapeutic yoga, is one of the most effective exercises for awakening the spine. Eliminate morning stiffness and restore joint mobility from the first hours of the day. Its effectiveness is explained by very clear biomechanical mechanisms. Alternating between spinal flexion and extension creates a natural pump that lubricates the vertebrae with synovial fluid, the fluid that nourishes and protects the joints. This process is key because the intervertebral discs lack direct blood supply and depend on movement to stay hydrated, resilient, and elastic. Biomechanical studies of the spine demonstrate that segmental mobility, especially in the thoracic and lumbar regions, reduces compression on the spinal nerves, decreasing discomfort associated with poor posture or excessive sedentary lifestyle. Furthermore, by rhythmically activating deep muscles such as the multifidus, transverse abdominis, and spinal erectors, the exercise improves core stability, considered by modern physiotherapy to be a determining factor in preventing hernias, recurrent low back pain, and degenerative wear. The sequence also releases tension accumulated in the posterior phase, increasing flexibility and allowing the return of a smoother, more fluid, and youthful movement pattern. If you struggle to keep your back straight, work seated, or wake up stiff, this exercise acts as a reset button for your posture, returning your spine to its natural function, moving, absorbing forces, and supporting your body without pain. But the benefits don't stop at bones and muscles. The cow-cat has a direct neurophysiological effect on respiration, stress, and the autonomic nervous system. Synchronizing the movement with diaphragmatic breathing, inhaling like a cow and exhaling like a cat, stimulates the vagus nerve, the main regulator of the parasympathetic system, responsible for physiological calm, digestion, rest, and cellular recovery. Research on heart rate variability, HRV, shows that exercises that combine mobility and deep breathing increase vagal tone, reduce cortisol, and improve cardiometabolic function, 3 markers directly associated with longevity and healthy aging. Furthermore, chest expansion during cow pose improves rib mobility, promoting a more efficient breathing pattern and avoiding the typical short, shallow breathing that accelerates fatigue and stress over time. This exercise helps retrain the body to move with rhythm, coordination, and motor control, qualities that are often lost with age, but which the neuroscience of movement demonstrates can be restored through repeated slow and conscious stimulation. Therefore, the cool cat is not just an exercise. It's a complete therapeutic tool to rejuvenate your spine, improve your posture, free your breathing, and clear your mind from the first minute of the day. Exercise 3. Adapted Child's Pose. Adapted Child's Pose is one of the most comprehensive therapeutic breaks for spinal health, especially when there is lower back pain, paravertebral stiffness, or accumulated tension due to stress. Unlike other, more aggressive stretches, this position uses gentle spinal flexion to promote decompression of the lumbar vertebrae, which is essential for people over 50, whose discs often lose hydration and height due to the natural decrease in proteolytic activity. By lowering the torso toward the floor and allowing gravity to act in a controlled manner, this creates an effect similar to passive traction, reducing pressure on the intervertebral discs and relieving nerve irritation associated with sciatica. In addition, by flexing the spine and relaxing the posterior muscles, the posture decreases the tone of the paravertebral muscles, spinal erectors, gluteus medius, and quadratus lumborum, 4 areas that are often overactive in people with poor posture or a sedentary lifestyle. From a facial perspective, posture helps release the superficial back line, a myofascial network that connects the skull to the sole of the foot, and which, when tense, limits mobility and promotes a slouched posture. It also has direct benefits on the respiratory pattern. By gently expanding the back of the chest, child's pose stimulates diaphragmatic breathing, improving oxygenation, rib mobility, and proprioceptive sensitivity. This is key because scientific evidence shows that deep breathing facilitates pain modulation, reduces muscle tension, and reflects and accelerates recovery from physical and mental fatigue. Therefore, this posture is not just a stretch, it is a biomechanical and neuromuscular tool to restore the spine and give back space to your postural system. But the most powerful benefit occurs in the nervous system, and this is where this posture shines for those over 50 who suffer from insomnia, anxiety, or stiff muscles due to stress. Passive trunk flexion and a protected body position activate the parasympathetic system, the same system that comes into play when we sleep, digest, or heal. Science has shown that restorative postures that combine gentle bending, deep breathing, and grounding increase vagal tone, reducing cortisol levels and activating physiological calming responses. In other words, this posture turns off the brain's alertness and relaxes the body from within, lowering blood pressure, reducing heart rate, and decreasing the perception of pain. That's why it's ideal for the day or before bed, when the mind is overstimulated and the spine has endured hours of gravity screens, emotional stress, or postural fatigue. Furthermore, neuroplasticity studies confirm that gentle exercises that induce deep relaxation improve the function of the pain inhibition system, teaching the brain not to react with stiffness and spasm to every movement with daily practice. Adapted child's pose helps restore lumbar mobility, improve postural hygiene, sleep better, and wake up without stiffness or pain. If you're looking for an exercise that heals your spine, calms your mind, and rejuvenates your nervous system, this is one of the most powerful habits you can incorporate after 50. Exercise 4 Butterfly. The butterfly position is one of the deepest and most therapeutic stretches for releasing accumulated tension in the hips, groin, and core muscles, areas that directly influence posture balance and the health of the lower back. With age, especially after 50, the hip capsule tends to lose elasticity, the adductor muscles shorten, and the pelvis adopts compensatory positions that increase pressure on the lumbar vertebrae. This stretch works by releasing the hip joint and reducing the stiffness of the iliac fascia, psoas adductors, and pelvic floor, tissues that form part of the so-called lumbopelvic girdle, a key system for maintaining a stable posture and an efficient gait pattern. When these structures are tense, the pelvis tilts forward, the lumbar curvature is accentuated, hyperlordosis is increased, and the vertebrae and discs become overloaded, causing discomfort when walking, difficulty bending over, and even pain when sitting. The butterfly pose, by progressively opening the hips, improves pelvic alignment, reduces traction on the lower back, and allows the spine to relax instead of overworking. In addition, maintaining the posture for a sustained period stimulates myofascial release and facilitates mobility of the pubic symphysis and acroiliac joints, which are essential for a stable and free gait. From a metabolic perspective, releasing the hip capsule improves local circulation, allowing for better exchange of nutrients and oxygen in the tissues, something especially relevant over time when blood flow decreases and recovery becomes slower. But perhaps the most surprising benefit of the butterfly is its impact on lower back pain, balance, and the nervous system. By opening the hip and reducing tension in the deep myofascial chain, especially the psoas, considered the muscle of posture and emotion, vertebral pressure is reduced, and the biomechanics of the entire spine is improved. According to multiple studies in musculoskeletal physiotherapy, stents is associated with chronic lower back pain, morning stiffness, and even fatigue when walking, because it alters lumbopelvic stability and forces the back to work in a compensatory manner. The butterfly, by relaxing the region, allows the body to recover its natural alignment, improving proprioception, neuromuscular connection, and range of motion while walking, qualities that tend to deteriorate after age 50, but are completely reversible with constant stimulation. Additionally, holding the posture with slow, deep breathing activates the vagus nerve, which reduces the sympathetic tone associated with stress and facilitates a physiological calming response. It lowers cortisol, reduces muscle tension, and improves pain perception. For this reason, the butterfly not only opens your hips, it re-educates your posture, decreases lumbar pressure, releases your groin, improves your balance, and makes walking feel more natural and light. Practiced daily, it becomes a powerful tool for regaining youthful movement, physical independence, and confidence as you move through your daily life. Exercise 5. Heel raises. The heel raise is an exercise as simple as it is powerful. It is known by many specialists as the heart pump because the calf muscles, especially the gastrocnemius and gastrocnemius muscles, function as a true peripheral pump that propels blood back to the heart. With age, venous return becomes less efficient due to loss of muscle tone, weakening of venous valves, and increased sedentary lifestyle, which causes swelling, heaviness, cramps, and even varicose veins. Performing rhythmic and sustained heel raises produces a muscular contraction that literally squeezes the deep veins of the leg, promoting blood return against gravity and improving tissue oxygenation. Studies in vascular physiology show that repeated activation of the solid can increase venous blood flow up to 10 times, reducing inflammation, preventing stasis, and relieving the sensation of tired legs. Additionally, this movement directly strengthens the lower posterior chain, calves, ankles, and intrinsic foot muscles, structures that play an essential but forgotten role in posture, gait, and balance. Over time, the ankles lose mobility, the arch of the foot weakens, and the stride becomes short and unstable. Heel raises act as a neuromuscular retraining exercise, improving Achilles tendon elasticity, ankle stability, and triceps strength. In older adults, strengthening the calf has even been observed to reduce the risk of falls, improve posture, and increase walking speed, one of the most robust markers of longevity, according to gerontological studies. But the benefit does not remain only in circulation. Heel raises have a profound impact on balance, mobility, and functional longevity. The calf is one of the body's primary anti-gravity muscles, and its strength is directly related to the ability to walk with a firm stride, climb stairs, remain stable on uneven terrain, and react quickly to a loss of balance. The science of balance explains that the ankles are the body's first line of defense against a fall, and strengthening them is better for the brain's ability to know where the body is in space. Each repetition sends signals to the cerebellum and vestibular system, fine-tuning postural reflexes that deteriorate with age. Furthermore, combining exercise with slow, controlled breathing activates the parasympathetic nervous system, reducing physiological stress and improving microcirculation. Increasing blood flow to the lower extremities has also been shown to improve mitochondrial function, metabolic efficiency, and exercise tolerance, making walking feel lighter, smoother, and less tiring. So, although it seems like a basic movement, the heel raise is a true longevity exercise. Protect your heart, prevent swelling, strengthen your stride, reduce the risk of falls, restore vitality to your legs, and improve your physical independence. To enhance the benefits of this routine and truly rejuvenate your posture and spine, it's essential to complement the exercises with key habits based on scientific evidence. First, consistency trumps intensity, as the adult body responds better to daily moderate stimuli than to sporadic efforts. Studies in neuroplasticity and mobility show that the brain needs frequent repetition to create new motor patterns and correct postures acquired over years. Furthermore, it is crucial to perform each exercise with diaphragmatic breathing, because this technique not only improves oxygenation and reduces stress, but also activates the vagus nerve. It reduces sympathetic tone and promotes deep muscle relaxation, increasing mobility in the hips, spine, and rib cage. Another essential point is conscious alignment. Keeping the abdomen gently engaged, the pelvis neutral, and the midsection forward improves neuromuscular control and prevents compensations that generate pain. It is also advisable to hydrate the body and move around every 45 to 60 minutes during the day, because prolonged immobility dehydrates the intervertebral discs and hardens the fascia, while short mobility, breaks like walking, stretching, or doing 10 heel raises, keep joints lubricated and activate circulation. In addition, including walking, good sleep, and adequate protein intake helps preserve muscle mass, a healthy spine, and stability when walking, as strength and balance deteriorate more rapidly after age 50 without regular stimulation. Finally, remember that the goal isn't just to eliminate pain, but to retrain your body to move freely, and that's achieved by listening to your limits, avoiding sudden rebounds, holding stretches for at least 30 to 60 seconds, and progressing at your own pace. If you incorporate these principles and practice the routine daily, even if it's just for 10 minutes, your brain, joints, and nervous system will begin to work in your favor. You will walk more lightly. You will feel less when you wake up. Your posture will naturally elevate, and you'll feel younger, more stable, and more confident with every step. This isn't a cosmetic change. It's the beginning of restoring your body, your movement, and your physical independence. Now that you know these exercises and how they can transform your posture, mobility, and daily well-being, I invite you to commit to practicing them daily. Your body has an incredible capacity for recovery, no matter your age, and today, you've taken the first step. If you want to continue strengthening your spine, relieving pain, and rejuvenating your movement, subscribe to the channel, like this video, and turn on the notification bell, because more routines are coming, tips and workouts designed especially for you. See you in the next video. Your new posture and new energy are already on their way. But that's not all. If you're looking to take your health and wellness to the next level and get that lean, muscular body you've always wanted, and we have something special for you. In the description of this video, you'll find a link to our fitness guide. In this guide, you'll learn complete step-by-step workout routines that will help you sculpt your dream body without having to go to the gym. You'll learn the correct way to perform exercises and workouts to achieve a lean, muscular physique. Don't miss this opportunity to transform your life. Simply scroll down and click the link to access our fitness guide. Your body and your health will thank you.